manipulate from there. So, um, go ahead and introduce yourself. I'd love to do a great introduction, but I know you can do better as far as your qualifications because they are vast. I appreciate it.
Well, my name is Thomas Levy. I'm a internist and a cardiologist, and for the last 30 years, 25 years, I've been a lawyer as well. But all of my work has been dedicated toward expanding medical concepts. The law degree was a bit of an odd occurrence, probably more for self-protection than anything else, because I think everybody realizes these days that in light of the pandemic, free speech is not available anymore, at least not completely free speech with an asterisk, as I like to say. So I was a
Yes.
regular cardiologist until 1993, and then, to make a long story short, I met Dr. Hal Huggins, who I consider to be the first biological dentist, really, in the world, in Colorado Springs, Colorado. Saw what he was doing, literally gave up my cardiology practice in the blink of an eye, and started working with Dr. Huggins with his dental patients that he got from around the world to deal with their many medical problems, which were always aggravated and or caused by dental infections, mercury, root canals, infected implants, and lack of good supplementation and lack of good dietary advice. So the patients would get all of that. And I saw things happen that weren't supposed to happen. At least medicine told me they weren't supposed to happen.
Yeah.
And I like to say Dr. Huggins began my first real medical education. So it took a dentist to teach me medicine.
Hmm.
And along the course of that, about the first patient I saw Dr. Huggins treat was a frail, old, neurologically incapacitated little old lady. And she got stronger and stronger and stronger as its extensive dental work went on. And I said, "What's going on?" And Hal pointed to the IV bag. And I said, "Okay, I'll bite. What's in it?" And he said, 50 grams of vitamin C. Well, that meant nothing to me at the time, except for the fact that whatever it was having a miraculous effect on this patient. So, literally, in that instant, in that moment, that set my path for the next 30 years in researching vitamin C, going further into dental toxicity. And as an offshoot of that, in the last few years, especially the pandemic, has brought me to the realization of a number of other things that augment the vitamin C impact and, in my opinion, uh, provide for potentially even more spectacular results for conditions that many people consider to be largely untreatable now.
Absolutely. And I consider your book, "Curing the Incurable," the Bible on vitamin C, and literally opened my eyes to something that similar to what you were talking about that wasn't even on the spectrum for me. Your typical RDA of vitamin C was a joke, but understanding that it is super essential and almost even vital. And the concept that most of inflammatory conditions and issues and disease states that people are dealing with come back down to that deficiency in vitamin C, almost like a modern day scurvy. Jump in though, flash forward to the incredible work that you did during COVID, and I was following a lot of that intensely, just because we had patients in the office that were just in vital states, and we were seeing incredible results with some of your protocols and things like that. But walk me through that journey from vitamin C, all the way to as you discussed, biooxidative therapies, as far as viral cures and stepping into that world.
Well, as I discuss when I make some of my presentations, it's important to start with the concept. It might seem simplistic, but I telling you it's true. The goal of any clinical protocol is to, at some point in time, somehow, some way, get normal levels of vitamin C inside the affected cells. Once you do that, you've got a normal cell again. And if it's present in enough cells, you've got infection resolution or medical condition or disease resolution or amelioration, as the case may be. Now, The the pandemic supplied a number of interesting angles. Before the pandemic had started, I was working on my own health. I had chronic, upper respiratory tract conditions. I'd hang on to colds forever. I was always stuffy up. And so I did my own research. And in the course of writing my book, Magnesium Reversing Disease, I came across something that sort of took me off guard. It was number one, nebulization, which of course is a very old technique, but not commonly used by many doctors. But number two, the nebulization of hydrogen peroxide. And when I dug into it, I said, wow, I'm going to do this. And so I did it. I got a great relief from a lot of my problems. But it triggered the situation where I was visiting family and friends in Cali, Colombia, South America, and before the pandemic. And one of my wife's friends had a cold at the time. And so I said, here, nebulize with the hydrogen peroxide. And well, gosh, within a minute or two, she stopped coughing every 15 seconds like she'd been doing. And the next day, she was largely normal. And then I was getting ready to leave Colombia shortly thereafter, and she she kind of begged me, saying, oh, can't you leave the nebulizer and the peroxide? Well, I mean, the two together was about a $35 investment. So I said, sure, go ahead, and take care of your family and friends when they get sick. Really, any type of upper respiratory tract infection, you should not have to suffer. I always emphasize this. You or your family should not have to suffer with the flu, with a cold, or whatever. Well, fast forward a year. We're 9 months into the pandemic, and I have occasion to have contact with her again. And I said, what's going on? He said, well, I've treated 20 cases of advanced COVID. I said, really? She sort of became the doctor of her barrio. And mind you, this is a poor barrio, so they weren't taking vitamin C, they weren't taking vitamin D, they weren't getting ivermectin, hydroxychloroquine, special diet, nothing. Yet she had 20 advanced cases. By advanced, I mean they were all short of breath. So if you're on nothing, have COVID, which a lot of them were documented to have, and you're short of breath, you're pretty close to pushing up tulips.
Yes.
So I said, well, what did you do? And she said, and she expanded on my protocol. I mean, I couldn't believe it. She said, well, I had them take the full 3% peroxide and nebulize for 30 minutes 3 times a day. 90 minutes of nebulization a day, 3%. And all 20 of them were completely cured in 5 days. And that was as a monotherapy. So, I mean, that I would never have been able to determine that on my own because I could never have denied anybody else the additional therapies that they could afford and had availability for. So I would say, well, it was hydrogen peroxide plus this, and this that resolved the COVID. But now I had a big underline and exclamation point as to how powerful peroxide nebulization was by itself. And that pretty much inspired me to push on and then research and write my book, Rapid Virus Recovery, which focused on the peroxide nebulization for the virus. I might add, we may or may not get into it. I almost called it rapid gut recovery because that's how quickly it would normalize your gut. All these people with the chronic bowel syndromes, they don't need to have them. But I said, well, no, probably the best title in the middle of the pandemic is Rapid Virus Recovery. Sure. And I don't want to complicate it and call it Rapid Virus and Gut Recovery. That'd just be a bit too much. But anyway, that I started by giving the book away, certainly in the PDF form. We've had about 185,000 ebooks given away, and I see on the website there's a lot more that have been out there. So a lot of people have received this, and I've gotten feedback from around the world. It's very gratifying. I've had a number of researchers in Ghana take similar measures and show that used prophylactically, the hydrogen peroxide completely eliminated the transmissibility of COVID to healthy people. By that I mean they had a big hospital system. treating lots of COVID patients, and they had roughly 1,000 employees that they worked with that wanted to take the peroxide, which was gargle with the peroxide once a day, sniff a little peroxide in the nose once a day. That's it. Versus about another 1,000 who didn't want to do that. I'm giving general terms here, but in a nutshell, the 1,000 that did it over the course of an extended period of time, 0 cases of COVID. Whereas those that didn't do it, about 40% of them got COVID. So this was, again, profound information, profoundly impactful, and of course, peroxide is cheap, non-toxic,
Yes.
available, doesn't require a doctor or a clinic, and although there's many other things that work very well, I'll wrap up on peroxide by saying, and especially what I've seen it do to chronic fungal infections people have, Crohn's disease, iliac disease, all of these sort of things. I don't think anybody being treated for anything should not have hydrogen peroxide nebulization as part of that treatment protocol, simply because it helps normalize the gut. And I'm sure you're aware, abnormal guts, leaky gut syndrome, overgrown microbiome, it's a mini industry in the healthcare industry because basically nobody knows what to do about it except try to suppress symptoms. Well, let me tell you, in a large number of people, the simple nebulization of peroxide normalizes the gut. So that's where we go right now. There's a lot of biooxidative therapies. Of course, there's the vitamin C, which works in concert with the hydrogen peroxide, especially in terms of killing pathogens by a mechanism called the FET reaction inside the cell. And the lesser used, but very, very good therapies are the ultraviolet blood irradiation, many different ozone applications, and we're now seeing some phenomenal stuff come out with what's called the EBOO, which is extracorporeal blood oxygenation and ozonation, which in a 60 to 80 minute session, amazingly enough, ozonates your entire blood supply. And even more significantly, or as significantly, I find, they have a dialysis filter in the middle of it that just pulls some of the most incredible sludge out of your system that you've ever seen in your life. And this is sort of counterintuitive at first, but then when you think about it, what do you think the oil filter is going to look like on a 20-year-old car that's never been changed? Same thing, crap accumulates, and it's all counterproductive, toxic, inhibits blood oxygenation, promotes coagulation, all the things you don't want in your blood. And then very, very good therapy, but unfortunately, much too costly and difficult to obtain to have wide application to the public is hyperbaric oxygen therapy. I mean, this is an incredibly potent therapy, but like I said, it costs a lot. There's not many really, and I'm talking about the hard chambers. You got to go up to 1.5, 2, 3 atmospheres, not this silly pseudo hyperbaric where you have the soft tank. You have the soft tank, you've got normal atmospheric pressure, apples and oranges. It's the pressure that does the trick. And all you need to do is see a couple cases of people that have faced, they had osteomyelitis, deep-seated bone infections, or deep-seated tooth infections, gum infections that are areas that are not healing, and go into the tank for a series of these treatments and see those things heal after not healing for years. So it's going to be very powerful, shall we say, in dealing with any sort of infection, viral or otherwise, once it penetrates. What I mean by that, penetrates like Lyme disease. What we're seeing now with the spike protein in COVID is just frightening and sad. We're seeing more and more and more evidence that it's getting deeply embedded inside the cells. For lack of a more elegant term, even intertwined with our nucleic acid inside the nucleus. And it raises a big question as to whether the protocols I have almost across the board are going to make somebody better and probably feel normal at the end of it, even if it's a long haul COVID, but the question is it going to last? Are they
Sure.
going to relapse a couple months down the road and have to go through it all over again? Answer is maybe. I don't know. Okay, so we have, with very prolonged high doses of vitamin C, seen cases, many cases actually, of Lyme get completely cured. So if there's an analogy or an analogous penetration of the COVID pathogen to that of the Lyme Borrelia pathogen, then maybe these things can work long term. Certainly, like any other infectious condition, when you hit it early on, you can pretty much wipe things out before they get deep inside the body. But once somebody's been sick for a very extended period of time, it's a whole nother ball of wax, as they like to say.
Yeah, absolutely. Before we leave it too far behind, would you be open to discussing the mechanism with nebulization of that hydrogen peroxide and how it impacts the viral load?
Sure. My pleasure, actually. First, I saw that hydrogen peroxide worked. Then, and of course, this is just me, this is before the pandemic. And then I decided to start combing the literature. And my goodness, just like always is the case, if I spend enough time on PubMed, the pearls just start popping out like hail. And first of all, it's important to understand, most people know this, but hydrogen peroxide is going to kill pathogens outside the body just as well as it does inside the body. And so we got all this crazy crap out there back in the days when Trump made the statement about bleach, and they said, oh, Trump wants you to take bleach inside your body, and they called hydrogen peroxide bleach since a very high concentration of peroxide will bleach something, no doubt about it. But what they failed to mention is, guess what? Inside your lungs, the respiratory epithelial cells naturally form and secrete hydrogen peroxide into the airspace. That's your body's natural protection against every pathogen you inhale with every breath. Wow. And if you don't have a super high load of pathogens, it does the job. So like anything else, when you get sick, it's because your natural response has been inadequate to the task, usually in dose or capacity or magnitude. So the peroxide nebulization just augments the body's natural response. The next thing is, what do you want out of an anti-pathogen? Well, you want it to kill the pathogen, and you don't want to leave behind any toxic byproducts of whatever it was you killed the pathogen with. Well, guess what happens after you kill a pathogen with peroxide? You know what you leave behind? You leave behind water and oxygen. Now, there's no two better substances to help heal a mucosal surface that's been damaged by an infection than hydration, water, and oxygenation, oxygen. So it's not only an effective remedy, it's nature's remedy, and it's the perfect remedy. You only get into toxicity at very high doses. There's absolutely no possibility of any significant toxicity when used at the recommended doses or lower. Simply does not exist. I like to point out that in the country every year, we have roughly, probably more these days, roughly 100,000 people die from prescription drugs, but this is the important point, prescription drugs that are taken as prescribed, not overdosed, not taken recklessly, not taken in some foolish way, but they took it like the prescription wrote it and they're dead. Okay, so those are serious toxicities that you need to deal with. The commonness of hydrogen peroxide, again, look at its byproducts. You have water, H2O, you have oxygen, O2, and you have hydrogen peroxide, H2O2. It's one of the most common molecules there is inside your body. It has a whole host of regulatory functions throughout your cells. Literally up to 5% of the oxygen in every breath you take, your body incorporates into brand new hydrogen peroxide inside your body. So I like to say when I'm talking to groups, everything, don't listen to the BS. Don't listen to the garbage. You're utilizing nature's perfect remedy. Literally, it's nature's perfect remedy.
Oh, I love it. Absolutely incredible. And easy, effective, cost effective. Absolutely incredible on those benefits. And we were actually using some of those protocols. I got to be careful how I say that because I know some of the trials that you've been through with your medical board and the nonsense that got perpetuated there. But yeah, we got nebulizers in, started following those protocols, and we're seeing even pulse ox in office start to elevate. That was the major indicator that everybody was looking at. If your pulse ox was this, then you're on that detrimental.
Have you noticed, or has anybody commented on, how my bowels have improved?
It wasn't something that we engaged in, but talk to me about that because I had written that down. I'm actually really intrigued on that because as a natural, I'm a chiropractor, but as a natural healthcare practitioners, I mean, we always come back to the gut, right? Like you mentioned leaky gut, and the gut is the pathway to so many different chronic diseases nowadays. But yeah, dive in there. I'd love to.
I noticed it first a couple years before the pandemic when I first started playing with, experimenting with peroxide nebulization for myself. So I finally had everything set up, and I did my first nebulization, 3% for 15 minutes, something like that. And then roughly 12 to 18 hours later, the next day, it almost shocked me. No, not almost shocked. It did shock me. I was, 67 years old. And I had the most incredible, perfectly well-formed, solid, satisfactory bowel movement of my life. I said, what happened? What on earth happened? Mm-hmm. And then I started thinking about it more and more and thinking about it more and more. And it occurred to me that, especially when you have a cold, but not necessarily because people get chronic pathogen colonization of their nose and throat covered by a biofilm after every flu, every cold, every upper respiratory tract infection, and unless they take a specific biofilm stripping agent, of which hydrogen peroxide is one, not the only one.
Yeah.
A biofilm stripping agent that will take off the biofilm, kill the pathogens, even though you don't have a sore throat, even though you don't have a runny nose, you've got that chronic pathogen colonization for life, And what happens every time you swallow? You swallow either the entire pathogen, you swallow the endotoxin or the exotoxin from the pathogen breakdown, you swallow the pro-oxidant metabolic byproducts of the pathogen, and if the pathogen dies and ruptures, you swallow a host of free iron, the most pro-oxidant reactive substance on the planet. Now, that goes into your gut, like the young people say, 24/7. You cannot maintain a normal gut with that. At least not to do what I just said at the start here and give you a normal, satisfactory bowel movement. I might also add, not to be indelicate, but there's nothing to wipe. I mean,
yes.
Usually if the consistency is such, you're smearing, nothing. For the first time, I understood what happened with dogs. You just run out there, tweak it out, and come jump in your lap and don't get poop all over your pants. I mean, it all has to do with the basic constituency of the flora in the bacteria that are in the gut. And so when you're able to do this, the microbiome heals, the leaky gut heals, and even without the quote-unquote normal bowel movement, I'm sure you well know what it does to your body to stop swallowing, or to stop passing across a leaky gut pathogens and new toxins and incompletely digested food on a daily basis. The other thing is that the gut, the cells in the ileum, where you have the leaky gut, if you're going to have it, has stem cells, intestinal stem cells, that turn over the epithelial cells every 3 to 5 days. So if you can just stop poisoning yourself for less than a week, you have a brand new gut.
Wow.
So these are not chronic diseases. They're chronically induced acute diseases. Okay, there's an important differentiation there. The chronically
That's huge.
induced. And what I also noted, and I now talk about in my lectures because I get these wonderful emails all the time. Shortly thereafter, I got this email from a lady who says, Dr. Levy, thank you, thank you, thank you, thank you, thank you. Goes on and on. My whole family has been bothered with black mold illness for decades.
Wow. Yeah.
We've all been sick with it. The kids have all been in the hospital. A couple have been on the ICU. We needed to be intubated. We've had to move out of the house and buy a new home and this, that. And said within one hydrogen peroxide nebulization, I and the rest of my family started feeling better than we have in years. A colleague of mine, Dr. Honeyhackey, had some spilling fungal antigens in his urine. He started doing this, the antigens disappeared. You don't maintain fungus inside your body unless you're continually seeding it from the gut. And then finally, perhaps most dramatically, just recently I got a letter. This, again, extremely grateful mother, her 16-year-old kid has been bedridden with Crohn's disease for years, taking all sort of drugs, could hardly get up, very weak, losing weight. Long story short, hydrogen peroxide nebulization, and within 4 or 5 months, as his mother put it, it was like a light switch went on, and he felt perfectly. He got up, started exercising, zero symptoms of Crohn's anymore. Now on all the high school sports teams, and leading a completely normal life. Now I'm sure you know they say Crohn's disease is a lifelong disease.
Correct. Incredible.
And that's why I made that point. All protocols treating anything for anything should at least include some peroxide nebulization just to do whatever you can do to stop the contribution of a screwed up gut to whatever the process is going on in your body.
I totally agree. That was the first thing and I, as a practitioner, I'm faulted on that. We saw it in so many different arenas, but you're opening up doors for me and hopefully, thousands of other doctors as this gets out there, of a baseline protocol that's very inexpensive. I mean, why not just, our mesh nebulizers were around $25 on Amazon. I mean, and just walking people through that. Would you mind just a quick little protocol, from your book? That's where we extrapolated, but the 3%, a mesh nebulizer, some saline, because saline coats a little bit better than just, water that can be an adjutant. And would you mind just covering that?
No. The thing is, as the lawyers like to say, it depends. It depends on what your goal is. I mean, if you're doing this to prevent infection, a very brief nebulization works. I tell all the dentists that I talk to, and I talk to quite a bunch of dentist organizations over the years, and I say, look, nobody other than your profession is exposed to more pathogens for more mouths for more hours. You're staring in front of an open mouth for 9, 10, 11 hours a day. Doesn't matter if at the end of the day you feel great. You've been exposed. Forget about it. Yes. You've been exposed. Go to your office, and before you go home, flip on your nebulizer and nebulize for 1 or 2 minutes. 1 or 2 minutes, and you'll do fine. And I've never had any feedback to the contrary there. Now, on the other hand, when you're dealing with an infection, you got a cold, you got a flu, you got COVID, whatever, you do it by feedback. You do it by how you respond, okay? And if you're not responding dramatically well, you increase the frequency and you increase the duration. The only reason to do less is if the 3% causes too much irritation and sneezing and runny nose. Then, rather than quit it, then, as you talked about with saline, dilute the 3% half and half down to 1.5% and go with that. But, and then, for like these people I just told you about, they'll work out for themselves, okay, what their best long-term maintenance is. Like this lady said with her son with Crohn's disease. I said, well, we don't nebulize peroxide regularly anymore, but we do it every few weeks for a while. So, I mean, they work out their own field for maintaining well. And I don't know that this is going to be the case for the population in general, but for me, I nebulize very rarely now. And you know when I nebulize? I nebulize when I don't have a perfect bowel movement. I don't have a perfect bowel movement, and then the next day it's fine again. So that's how my body functions. That's how it goes off. So, but probably with the babies, I add the little proviso here that
Yes.
with the babies and the tiny kids that don't know how to blow their nose or cough up stuff, mamas should have little suction devices to make sure as secretions are generated, you pull those out, and the little one doesn't choke on anything like that. The other thing too is, and this probably affects the younger ones more too, is depending on how you nebulize, if you get the mist into the eyes will burn. So you don't want to irritate the eyes. And if you can't find a way to angle your head, then just nebulize in front of a small fan, and that takes care of it right there.
Oh yeah. Oh, that's a great angle. Incredible. Well, where do you, where do you see this going, or developments on this, with the caveat and understanding your law degree and the reason for that? I'm in a battle right now myself, but for similar but different in your aspects. But where do you see this going? I mean, what do we see with advancements? And you mentioned EBO and other therapies. I mean, we do major autohemotherapy. We do ultraviolet light, blood irradiation. Obviously, this is a package that everybody's got to go home with, that I'm seeing in the clinic. But where do you see that for the majority in the next 5-10 years?
Next 5 or 10, that's hard to say. I will say this. I only see a victory, if you will, coming about if at some point in time there's enough pressure brought to bear that Congress forces by law insurance companies to pay for whatever the patient wants to pay for. Then I guarantee you they'll leave mainstream medicine in droves. Okay? They don't, it's, and why that could happen is, again, the pandemic. There's more people now than ever before that realize, and let me say this perfectly clear, mainstream traditional medicine right now is the biggest fraud that's ever been perpetrated on the planet.
Yes.
Okay, it's pure fraud, but it's worse than pure fraud because most of the treatments not only don't do any good, they make the patient worse. And even worse than that, the system is set up, as you're aware, to actively suppress those treatments that do you good and actually help reverse the underlying disease.
Yes.
When I see all the patients that have died on the intensive care unit in septic shock, and I can't tell you the number of emails I've gotten from people begging for help around the world, those doctors need to go to jail. They need to go to jail for negligent manslaughter. Sometimes homicide, but at the very least negligent manslaughter, because they'll refuse, as you well know, to look at the data or do anything else. They're saying, it's my damn sandbox, and I'm going to do whatever the hell I want in it. Go to hell. Okay? I mean, that is the pure cold attitude you get. You don't even get respect or courtesy. Okay? You're just part of their system that they couldn't give a damn less about. So these things, and let me say this was very interesting to me too. So I told you about I consider 3 important things have happened because of the pandemic. Number one is the public, much of the public, realizing the fraud that modern medicine is. That's number one.
Trust is
Number
fractured,
2 is more people now know about and take vitamin C on a regular basis than ever before.
Yes.
And number 3, same thing on hydrogen peroxide. When this pandemic started, I don't know, within a week or two, I went by Walmart and there was no vitamin C on the shelf and there was no peroxide. Now, mind you, at that time, the peroxide section was 9 or 10 bottles on a lower shelf, this, that, and the other. in just a small area for the vitamin C. Well, probably as of Halloween, when you walk into a Walmart, they have all the candy stacked up as you walk through a big long line. Well, as you walked into Walmart, they had these long shelves where they must have had several hundred bottles of hydrogen peroxide. So they clearly have the increased demand. So people are coming around, they're waking up, they just have to deal with the horrible, horrible, horrible reality that for the most part their doctor doesn't give a damn.
Yeah, that's a harsh reality. I was reading an article this morning by Mercola posted it. It's like that said the number one cause of death and disability worldwide is now medicine in general combined. When we look at the combination of the jab, it is the number one cause.
Always has been, but even more dramatically now. Yes, absolutely.
With that. Just a quick spin on long haulers. I know you've heard of it a lot, and a lot of these people that are emailing you are probably dealing with that in some shape or form. And how do you see from the nebulization to the biooxidative therapies and vitamin C being able to plug in for that? Are you specifically recommending certain treatments? And the caveat, I guess, if I will, that I've been seeing just in our small little local town, our nurses and even other medical doctors starting to reach out, talking about just this unbelievable viral replication. I mean, the people still coming in more unusual this time of year with flus and colds and just this recurrent, like you were talking about viral loads, which makes sense with that biofilm. But back to, the long haulers and potentially even unwinding some of this DNA attachment. Your thoughts on that?
Well, I don't want to be the picture of doom and gloom, but I will say this, is that as the acute pandemic has subsided, we're now seeing the really big chronic pandemic.
Yes.
And the chronic pandemic is from the fact that so many people really never got over their COVID and the number of people that have been damaged by the vaccine. It all circulates around, and this is pretty well established now, the spike protein of the COVID pathogen. And so many people now have what I call persistent spike protein syndrome, PSP syndrome. This is, in the case of chronic COVID, it can occur with somebody who's never had a vaccine, but just had a poor enough immune system that they weren't able to completely knock out the virus or the pathogen, whatever you want to call it, when they first encountered it. But, as I was mentioning earlier about a few pathogens in the respiratory tract and the body being able to knock it out and everything being pathogen-wise due to dosage and exposure. So with that in regard, even though it can happen with just having COVID, we're now finally seeing, because even in the literature, they're very reluctant to, if not tell the truth, at least be very clear in telling the truth. And they're now having more and more articles make it quite clear, and it's quite clear to me, to my satisfaction, that the vast majority of chronic COVIDs are those that have been vaccinated and have gotten COVID. Okay, why? Well, it's dose. Okay, what is the vaccination injection designed to do? Put messenger RNA inside your body to start making large amounts of spike protein, presumably, so that you can mount an immune response to it. If only. But the fact of the matter is they're huge doses of spike protein. And one of my most practical points that I try to make to people these days is, look, if you got one or two vaccinations and you did well, or you feel okay, or you're fine, don't get smug and happy. And remember, under no circumstances at all, consider getting a booster for any reason at all, or you could pay a major price. Now, with the chronic COVID, regardless of where the spike protein comes from, we now have a lot of data that shows that little old spike protein goes everywhere. The biggies are in the brain in the heart, in the gut, and general fatigue. All of these things get hit really, really, really hard. The problem with the heart is there's so many people that have gotten affected in their heart, but then the syndrome winds down very low but doesn't completely resolve. What I mean by that is a lot of people out there now have subclinical myocarditis. They may or may not have a rare chest pain, but for the most part, they're doing pretty good. But when they get that big stress situation, the big adrenaline surge, there's enough residual cells in their conduction system that are irritable and then start an arrhythmia that can be benign or be fatal. And I mean, even now today, I don't think there's, relative to earlier in the pandemic, there's that many people getting their first vaccinations anymore, yet we're still seeing the athletes drop like flies in Europe, and now we're starting to see more and more of them in America, okay, in the United States. You need to look for the troponin level. The troponin level means there's damage in the heart. But the important thing that I now recognize and I realize is you can't be too smug and happy if your troponin is completely negative until you've had a stress test, until you've had a Holter monitor to show that you're having no problems with arrhythmias, until you've been able to show that until you're able to show that you don't have the, shall I say, cardiac weakness. They have a postural orthostatic tachycardia syndrome, POTS, which is basically your pulse is 70, 75, and you get up and walk across the room and it's 130. Okay, so that is never normal and it should never be accepted as normal. That's a good ongoing spike protein presence. Now, of course, we have a lot of stuff going on, and it's complicated by the fact of the proclotting, of the thrombotic effects. Okay.
Yes.
So, as far as protocols go, now I want to emphasize to anybody that's listening, there's 101 protocols that you use, and any one of them will work on a given person. Okay. So it doesn't mean there's only one thing you can do, but everything is based on effectiveness, availability, expense, motivation of the patient. A lot of times I see docs going crazy, well, you need to do this, and they go through like a dozen different things, and it's kind of like, well, so that's too much, so I'm not going to do anything. So I mean, as they say, the old principle KISS, keep it simple, stupid, and there's a good reason for that. So you start, in my opinion, with the powerful, absolutely, the hydrogen peroxide nebulization, as we've discussed, absolutely. The administration of the highest doses of vitamin C that you can tolerate, whether orally or by vein. If you can get it by vein, absolutely. The use, and this involves the physician, of doses of hydrocortisone, cortisol, not prednisone, not methylprednisolone, not pharmaceutical agents that don't exist naturally. We're talking about the cortisol that your adrenal glands makes. So when you take a dose of that, 10, 15, 20 milligrams, along with your dose, I keep getting messages from my family.
You're good. I get it.
So when you take this cortisol with the vitamin C, it turns out, and we don't have enough time to talk about it in detail, what is cortisol and steroids known for? Cortisol and steroids are known for being the most powerful anti-inflammatory agents that we know of.
Yes.
Well, actually, they're not. What they are is the best way to get the most powerful anti-inflammatory substance, vitamin C, inside your cell.
Wow.
So that's why they're powerful anti-inflammatory agents, because they promote and pressurize vitamin C uptake inside your cells. So taking cortisol with your vitamin C dose supercharges it. And if you're just doing one dose a day, especially while you're sick, not indefinitely for life, you're going to do fine. You're not going to be any steroid side effects or anything like this. And for the most part, you're going to be over your infection in a few days. Now, you'll never get side effects from this and these doses because it's hormone replacement. It's not like taking a large dose of testosterone, estrogen, or anything else. As long as you're treating deficiencies and as long as you're not exceeding what should occur normally. Okay, so there's vitamin C, preferably with hydrocortisone, hydrogen peroxide nebulization, methylene blue, one of the most potent medicines I've ever seen that has been shown in the literature to resolve advanced septic shock from COVID, where the patients are intubated and have coded. And upon being coded, they're given methylene blue and they come back and they get discharged. Wow. Absolutely one of the most powerful things I've ever seen in my life. It's a potent antioxidant, just like vitamin C. But perhaps even better than vitamin C, it gets everywhere in the body because it's water soluble, lipid soluble, small molecule, rapidly gets up inside the brain where vitamin C in its reduced state does not get. You only get vitamin C inside the brain in the oxidized state, DHAA. This is something else where you work these things together. And that's your basic protocol, but you also need the thrombolytic enzymes. You need the nattokinase, the lumbrokinase, the serrapeptase, the bromelain, and the N-acetylcysteine, especially if your D-dimer level is elevated. The D-dimer indicates that there are clots that have formed that are breaking up. So you need to make sure that you take enough of these so that the D-dimer eventually comes back to normal and stays normal. And if you've never had a problem with clotting, I still think it's an excellent idea to take nattokinase for life. I mean, it's a derivative of what the Asian populations eat all day long. So you're really just taking a good food.
Yeah.
So these are the things that I consider most important. Now, the other biooxidative therapies, the ozone is fantastic if you have access to it. The EBU that we mentioned is fantastic if you have access to it. Same thing with the ultraviolet blood irradiation and, of course, the hyperbaric oxygen. So let's flip the coin then and say, you did all of this and you're not feeling better at all. Well, unless you're extremely poor, you need to get your money together and go to the top flight at the end of the line and get the EBU and the hyperbaric oxygen treatment, along with your vitamin C and the other things that you're taking. Okay, so as long as you have the financial ability to get there, you don't give up the ghost and stay sick for the rest of your shortened life.
Love it. Love it. Phenomenal. And we're coming up on about 50 minutes. And I don't want to numb that out at all. I mean, that is beautiful protocol for long haulers and all of us in general. I have teenagers that are in sports, and coming just from a cardiologist standpoint, would you recommend, of course, my kids never got vaccinated, but I take care of a lot of these athletes that were made the decision to do that so they could keep participating, didn't want to test on a regular basis. Your recommendations, would it be to get the troponin levels tested, to stress test with a cardiologist? I mean, just walk me through as a doctor on the sidelines of a football team. You know, my biggest
I might
biggest
not have
worry.
said it a year ago, but what's come out since then, with the fact that there can be still so many problems with a negative troponin. To answer your question, yes, get the troponin for sure, because if it's at all elevated, you can't stop until that's brought back into the normal range. Same thing with the D-dimer. So you absolutely have to get the troponin and the D-dimer. You know, a CRP is a good idea as well, as along with the baseline blood work.
Active
Now,
protein,
we start to get into cost efficiency here. I mean, for somebody, for a parent that says, I don't care what the cost is, do your best to make sure my child's okay, then the answer to your question is yes. Troponin negative, D-dimer level negative, cardiac stress testing, and Holter monitoring. Make sure those are both completely normal. More so now, that's in the asymptomatic young person. If the young person is, oh, I get this pain every now and then, no, you got to go a step further. Then you need to do the cardiac imaging with late gadolinium enhancement to see if there's any little areas of the heart that are inflamed, but not inflamed to the point that they're triggering a troponin reaction.
Okay.
But asymptomatic with the parent that doesn't mind paying, get the stress test and get the Holter monitor as well. Yeah.
I love it. Well, thank you for this. And anything else you want to add, or anything else that's pressing?
Well, it's even more true now than it was for the many years that I've said it on other podcasts, etc. Is they say, well, what are your parting words of wisdom? And how wise it is, I don't know. But the thing is if you leave your health care completely in somebody else's hand, you're going to suffer for it. You're not going to get the treatment that you need. I mean, some people don't like to think. Well, if you don't like to think, you're not going to get what you deserve. I mean, people need to educate themselves, but most importantly, they need to find a doctor who'll talk to them. If you go into some doctor's office and ask a question, they say, "I don't have time for that," or this, that, don't walk out of that office, run out of that office, okay? I mean, you determine who you see and what does what to you. There's a lot of good doctors out there. Unfortunately, the percentage of the total doctor population is not large, but there are doctors out there, integrative and such, that can do a lot of good for you. The other thing is you can't, people hate the dentist. I understand. Who wants to see the dentist, okay? I don't. You don't. Nobody does. But that doesn't mean you can afford to overlook the primary cause of all disease, which is occult dental infections, gum, teeth, root canals, tonsils, sinuses. Wow. Everybody needs a cone beam examination of their mouth. Period. End of story. Because you can have frankly abscessed teeth that feel normal, function normal, no pain, no nothing, yet they're going to bring you down like a focal infection anywhere else in the body. So that needs to be addressed. And like I tell everybody else, anybody that's listening, you can have my email address and can ask for more information. And I usually give away a few ebooks and some pertinent articles and what we've talked about here, so that people have a direction to go in. But it's not a consult. So don't send me an email and say, I got this, and this. What do I do?
Yeah, I know how that is for sure. Well, Dr. Levy, I so appreciate your time today and your benefit to humanity just with your research and all you've been through. So thank you so much for showing up today, and I'll keep you updated as this starts to go into text and get you whatever you need out of this too. So I appreciate it.
Very good. Thank you, sir.
All right. And you're, yes, and you're in, you said Florida, and when?
Florida, close to Miami.
Yeah. Okay. And you're teaching out there.
Oh, and I'm in Fort Lauderdale.
Fort Lauderdale.
Yeah. June 8th.
June 8th. Okay. I'll look it up. Maybe I can make a quick trip out there.
All right.
All right. Thank you, sir.
All right. Take care.
All right. You too. Bye-bye.